Weight loss drugs are exploding in popularity across the country, with many calling them game changers when it comes to treating obesity and all the medical conditions that come with it. But at the same time, as more people use these drugs, there are growing concerns over potentially serious side effects, everything from intestinal blockages to even blindness. Spotlight on America, national investigative correspondent Angie Moreski looks at whether these so-called miracle drugs could be a double-edged sword.
I've got protein shakes.
Peter Bernard is excited about his weight loss journey, not only eating healthier and exercising more, but also using Zepbound, one of the new GLP-1 drugs to control his appetite. A weekly injection, he says it's been a game changer. After just 3 months, down 30 pounds.
I don't think I could have done that on my own. No way.
It all started when Ozempic was FDA approved to treat diabetes in 2017.
Ozempic lowers the risk of major cardiovascular events.
Along with health benefits, patients started losing weight, which led to more drugs.
Have you always had trouble with your weight?
Including Wegovy.
Weight loss.
And Zepbound, FDA approved to treat obesity.
It's been a revolution for obesity medicine.
Dr. Ivania Rizzo is director of obesity medicine at Boston Medical Center.
Health benefits for sugars, health benefits for high blood pressure, health benefits for cholesterol.
The drugs work in part by slowing digestion and gastric emptying, which can cause side effects.
The greatest side effects are usually gastrointestinal, with meaning that like nausea. More extreme would be vomiting, diarrhea, or constipation.
When I'm feeling a little nauseous, I can almost always tolerate some chicken soup.
Peter has experienced the more common side effects, but some report much more serious complications, including bowel obstruction, gallstone attacks, pancreatitis, gastroparesis, even sudden blindness.
We're seeing many patients who have been severely harmed by these drugs.
Attorney Jonathan Orent represents clients suing the makers of GLP-1 drugs, including Novo Nordisk and Eli Lilly, alleging they have not done enough to warn patients and doctors about serious risks.
What are some of the most serious side effects you're seeing with patients?
We've seen individuals who suffer blindness, bowel blockages that result in some sort of perforation of the bowel, sepsis, and can ultimately lead to death.
Spotlight contacted both Novo Nordisk and Eli Lilly. Both declined interviews but sent statements. Novo Nordisk saying they remain confident in the benefit-risk profile of their GLP-1 medicines when used consistent with their indications and product labeling. And Eli Lilly saying their FDA-approved labels include robust warnings, including that Mounjaro and Zepbound may be associated with gastrointestinal adverse reactions, sometimes severe.
These more serious side effects, are you seeing them in your practice?
I have seen people who have had, in very rare situations, for example, obstruction.
Dr. Rizzo says for the most part she's seen more good as a result of the drugs, but adds you must weigh the risks versus benefits for each patient, and emphasizes she does not prescribe them for cosmetic weight loss.
These medications are for people who have a disease.
For Peter, who also has high blood pressure and cholesterol and sleep apnea, it's made all the difference.
This is where I used to cinch my belt.
And while he's excited about the progress he's made shrinking his waistline,
Down to here.
he has researched the risks and says for him, it's worth it.
I do have some concerns about it in that what happens 10 years from now. I'm going to roll the dice. I'm rolling the dice. It's working for me now.
For Spotlight on America,
Jim.
I'm Angie Moreski.
Now, experts agree that more research needs to be done on the long-term effects of these drugs. Most patients who stop taking them do end up gaining most, if not all, the weight back. So typically you must take the drugs for the rest of your life to maintain the benefits.